everyone. Welcome to the Mental Health and Wellbeing Global Summit. We are so happy to be here with all of you across all of these different countries. This summit exists because of the John W. Brick Foundation. This is the third global summit that they have hosted. And today you're going to get to hear about this very special foundation and the founders. My name is Alyssa Eppel. I am a health researcher and a scientific advisory board member of the John W. Brick Mental Health Foundation. And I'm going to interview Victor and Lynne Brick, the founders of the foundation, today. In 2015, they founded the foundation in memory of Victor's oldest brother, John, who struggled throughout his life with mental health, but was never once offered a holistic plan to support his well-being. The mission of the foundation is to change the way the world treats mental health. Victor is an author, motivational speaker, and fitness personality. Lynne is a former shock trauma nurse. Together, they co-founded the John W. Brick Mental Health Foundation, as well as many other businesses that help facilitate having this nonprofit foundation. They have been global leaders in the fitness movement, and now they are taking on mental health and the connection to physical fitness in a way that is so inspiring. So let me jump right in. Hello, Victor and Lynne, welcome.
Great to see you, Alyssa. Thank you very much.
It's really exciting to be here and reaching so many people and really sharing the origin of why we're here and the uniqueness of the foundation, which really is one of a kind in the whole world serving this mission. So why don't we start by having you tell us a bit about what inspired you to start the foundation? What's its purpose and mission?
Certainly. My brother John, my oldest brother, suffered from schizophrenia his entire life and eventually succumbed from the disease. And I believe it was as much from the medication that he took for the disease as it was the disease itself. And in all the years of his treatment, sometimes in the best medical institutions in the world, he never once was put in a fully integrated, holistic program that included such things as exercise, diet, and nutritional practices, along with the conventional forms of treatment, that being, of course, medication, psychoanalysis, and institutionalization. And at his funeral, now this was my oldest brother, by far there was 5 of us, 4 boys and a girl, and he's by far the most gifted of the lot. And he was followed around with this black cloud of mental health and was never able to get out from under it. And at his funeral, the only people there were the immediate family, my brothers and sister and ourselves. And I said to myself, it was as if John's life didn't matter. And I said, this is not how John's going to go out. This very special individual mattered. His life mattered, and his life, had worth. So it was then and there that we decided to start the John W. Brick Mental Health Foundation, named after John, which is dedicated to the mission of the John W. Brick is to change the way the world treats mental health. And the purpose is to integrate salutogenic self-care approaches such as exercise, nutrition, and mind-body practices into the treatment of mental illness and the promotion of mental well-being and mental wellness. So that is the genesis of the John W. Brick Foundation. We did not want other families to have to go through and other individuals to go through what John went through and other families to go through what we had to go through. And that was this vicious cycle of John being sick, getting on medication, feeling better, getting off medication, spiraling back down again, and the whole cycle repeating. We understand that there is a need for the traditional medical treatments and the healthcare interventions and the healthcare approach, but we believe that it should be integrated. Self-care approaches and lifestyle approaches along with medical approaches to basically improve quality of life and lessen the destructive effects of mental illness.
It's so moving, Victor. And when you said his life mattered. I got the chills for so many reasons. One, the suffering, the unwellness that he had from the medications, from the lack of seeing him as a whole person that had the ability to have high quality life, nutrition, relationships, is the suffering has not been unnoticed. And what you have made with his name has affected so many people. You'll all hear about the impact of the foundation so far, which is new and has had a big education as well as research component. And just the pain and suffering that your family went through, such a close and loving family, it really is a whole family system that is affected when one person has mental illness. The foundation has really unique perspectives on mental health. I would love to hear more about that, Lynne and Victor.
Well, yes, we do have unique perspectives because, as Victor mentioned, we are focusing on integrating salutogenic self-care practices into the delivery of mental well-being and really helping folks with mental health or mental well-being issues. So, yeah. You want to talk about self-care and health?
Right. So I mentioned earlier the term self-care. So we see this model, mental health and well-being model, being kind of like a yin and yang, where you have self-care, which is things you and your support system and those around you can do, your lifestyle choices, but it's kind of up to you. And then we see the healthcare. Think of the yin as the black, and the yin as the self-care black, and the healthcare is the white, and that is what the medical profession can provide. And we see the integration of the two being the most effective way to treat the whole person and prevent them from experiencing the devastation or getting stuck in the cycle that I talked about previously, and also lessening the effects of their bad periods.
So a couple of things about self-care. First of all, the cornerstone of self-care really is all about movement. And it's just about the concept also of putting your oxygen mask on first so then you can help other people around you. But movement is really the crux or the cornerstone of what self-care really is. Another thing I love to say is that self-care is not selfish. So it's you have permission to move in multiple ways. And we'll go into a little bit more detail. But why is movement so important? Because first of all, it helps your body secrete the happy hormones, the dopamine, the serotonin, endorphins, and oxytocin, the big fat four that help to elevate your mood on a regular basis, and not just when you're exercising, but sustainable mood elevation for up to 4 to 8 hours after you move on a regular basis. So we're very excited about that. And here's the other thing too. According to a Duke study, exercise, a moderate to vigorous exercise, is equivalent to an entry-level dose of Zoloft, a medication that's commonly used.
But more effective long-term.
Yes, it is more effective long-term.
Without the side effects.
Without
Correct.
the side effects.
Mm-hmm.
So when we talk about movement, we're not simply talking about exercise, although to us in the fitness space, that's the core. But when you think, you're getting your mind to move. When you feel, you're getting your heart to move. It's all about movement. Our daughter, unfortunately, has been battling, has been in a battle with cancer, in the recovery phase now and doing great. But one of the things that her holistic doctors talk about is that she has to get her digestive system moving, and you need all your organs functioning properly. Movement is critical to the human body. It's just critical. So that's where we come in with the self-care and the healthcare. It's not just pharmaceuticals. It's a lifestyle.
And collaboratively working together.
We also talk about the Yerkes-Dodson law of positive stress, which states that if you think of a graph, the rise is performance and the run is stress. And the Yerkes-Dodson law states that performance improves with stress to a point.
Mm-hmm.
So if you give it the positive stress, just like with a muscle development or with learning an instrument or being able to take a class, learn a language, you give positive stress, they improve. Too much stress overwhelms them and actually retards improvement. Not enough stress, there's no change. So one of the things we promote is putting what do pharmaceuticals and narcotic drugs do? They almost eliminate stress. So you're working against what the body needs. The body needs stress. Every child needs to walk. You can't just let them crawl around forever. And everybody needs to improve and to learn. You need some form of stress, a positive stress. Too much, as I said, is destructive. So that's another big part of our approach of our program and what we promote.
So I have been trained as a clinical psychologist in the current mental health system. And so I, like other people trained in traditional treatment modalities, view serious mental illness, schizophrenia, serious depression as something where we just want to reduce the symptoms, right? And we're successful if we can just bring down the symptoms, the physical symptoms, the distress. But the model that you guys have introduced me to goes way beyond that. So tell us about how you view mental health, the dual continuum model of mental health.
The dual continuum, historically, mental illness has been viewed as a continuum with no mental illness, mild mental illness in the middle, and then extreme mental illness, clinically diagnosed schizophrenia, bipolar, serious depression at the far extreme. And people move up and down this continuum based on their life events, but they're always exhibiting signs of a pathogenic condition. So if you don't have a pathogenic condition, you're fine. But if you do, you're part of this continuum. Mm-hmm. The Mental Wellness Initiative of the Global Wellness Institute, of which I'm a member of the Mental Wellness Initiative, developed the dual continuum model. And it still contains the pathogenic model, no mental illness, mild mental illness, severe mental illness, but it's added, that's a horizontal, but it's added a vertical continuum. And the vertical continuum goes from languishing at the bottom to flourishing at the top. And you can have no mental illness, none. And you've lost your job, your wife's left you, you're overweight, you smoke, you have a terminal disease, and you can be languishing. Mm-hmm. And you can have a clinically diagnosed mental condition, schizophrenia, depression, all kinds. You have the job, positive stress job, not an overstress job, positive stress job. You have a loving wife, you have a supportive family, your finances are in order, and you have a strong faith in something, you can be flourishing. So it's no longer doomed because of this pathogenic. The pathogenic condition, pathogenic means illness. That's the medical. The salutogenic means wellness related. That's lifestyle. This is healthcare and this is self-care, and they work together. And the goal, no matter where you are on this vertical continuum, is to get people flourishing.
Yes.
And the best example.
So beautiful.
The perfect example of that. And I didn't even realize it because sometimes I focus so much on my brother John. My brother Bob suffers from schizophrenia too. And he's had a very hard time with it, not as hard as John, but he was living at home with my parents for the last 20 years. And when my mom passed 12 years ago, we figured Bob had about 3 years to live. We figured there was no way he was going to get by without Mom, who was doing everything for him, no stress whatsoever. Mm-hmm. And we got him a full-time housekeeper, and we just kind of were waiting. Within 6 months, he had gotten rid of the full-time housekeeper. He's taking care of the house himself. My brother, Merrill, started taking him to the gym, started watching what he ate, started cutting down on his cigarettes, went from 2 packs a day to 2 a day. Bob's lost 60 pounds. This was 12 years ago. He's living in the house by himself. He has a job. he is happy. He's flourishing. He's happier than a lot of people.
So what was it that changed that helped him enter this flourishing path?
Support system. A support system that never gave up on him. And we said, let's practice what we preach. And it was a combination of the diet and nutrition, the exercise, and a support system.
And in addition to that, it was a consistent lifestyle shift. So his lifestyle became a new habit of healthy activity. And in addition to that, his medication is reduced to half of what it used to be.
He's a pathogenic situation. So,
it's just a beautiful example that people can be living with SMI or severe mental illness and be having a meaningful, purposeful, healthy life. This is such an inspiring story. When I think of the dual continuum model, I always thought of John and how sad it was that he wasn't given the opportunity. He was given the meds to reduce the symptoms, but he wasn't given those supports to flourish. And so now I'll think of Bob when I think of the dual continuum model.
And let me relate it to positive stress. I'd call Bob up. I'd say, Bob, how you doing? I don't know, Vic. Merrill's killing me. He's making me work out all the time. It was positive stress. We put him under stress. We wouldn't let him smoke. We had to take control of a lot of phases of his life. But now he's glad we did and does it on his own.
And I think about the stages of dealing with mental health crises. And so, there's an inpatient stage of stabilization, and it's incredibly stressful for everyone, the family. I mean, talk about trauma. It's the in and outs of ER rooms and inpatient wards. And so even, there's lifestyle of management, but even in the acute crises, I've been so moved by what you guys have done in inpatient wards by providing treadmills, exercise equipment. It just makes so much sense to offer those outlets during those times of really peak life stress and trauma. What have you seen or heard about those programs that you've started?
Thank you, Alyssa, for your kind words too. And we're very proud of the fact that when we incorporated treadmills and some other kinds of cardio pieces at the Johns Hopkins Children's Ward, they had, ironically, it was the same place where Brother John used to be a patient, an inpatient, and they had that little isolation room with a little tiny window. You could look in, and usually the kids were, either tied or restrained.
With John.
With John.
Back in the day.
They were still restrained and all this kind of stuff, so they wouldn't hurt themselves or harm themselves. Ironically, today, the same room exists with a little tiny window, but they've reduced the use of that isolation room by 90% at Johns Hopkins.
In the years since we gave them the exercise equipment, the use of that room, need for the use of that room has gone down 90%.
I just want that model to be transmitted across the world. I mean, any family who knows what that means to have their loved one restrained, then to think that could be avoided with some of these healthily positive stress outlets it's just remarkable. It's brilliant. And I'm so glad that you're spreading that model. Now, another model you've spread, I would love to talk about. So Merrill has been Bob's coach, support, personal trainer. And how can we think about getting people with depression and other mental health issues to exercise? I mean, it's the last thing they want to do. So what are your thoughts on how to create that positive stress as a lifestyle?
Well, I can help answer that question because that is a good place for people to start. For example, in the Move Your Mental Health report that's found on the John W. Brick Mental Health Foundation website, it clearly states that folks that experience some form of depression will be a little bit more compliant when they have someone to work out with, a personal trainer to help guide and hold their hand. And that's exactly what Merrill's done in Bob's case. Also, the consistency is really, really critical. 3 to 5 times per week. If or just getting someone to move whichever way they feel most comfortable. Maybe it's just by starting by taking a few deep breaths. That might be where the place where they start.
Yes, starting from within, but using the body. You've got to start and ramp up from there.
So,
and how do you, Lynne, you've been so dedicated to starting this certification program for fitness professionals. And both of you have devoted a big arm of the foundation toward really adding a new mental health profession, really, where there was a gap. And now that you're in the process of this, I just think that was such a big gap. How did we not see that before? Tell us about the certification program.
We're very excited because we're launching the world's first mental well-being certification, and it's going to be basically harnessing the power of evidence-based science and psychological perspective on exercise, nutrition, and mind-body practices. Those are our big pillars, and also connectivity.
Well, it's the first trainers.
Yeah, it's the first for fitness professionals. Correct. And so we're very excited about launching this because we feel that while a lot of fitness professionals understand the mechanisms of key elements of different forms of exercise, it's having those very important, significant conversations to help pull out the best in people and help people to feel that they're never alone, that they can collaborate with their coach, their trainer, or their instructor on how to improve their mood, their mental well-being. And like Victor said, in a moment's notice, anyone's life can shift or change. And some people may be struggling. And what are the right words to say? What is the right mechanism to help each of their clients?
So, in answer to your question philosophically, Alyssa, it's one of the, unfortunately, hardest things in this to do. If you have cancer, nobody fights intervention. You lost a leg or you have a bad back, nobody fights the treatment. Mental health is a whole different ballgame. The patient is their own worst enemy. You really need to have a support system that is dedicated to the self-care, and they've got to live it. My brother said that he thought we should get Bob a bike for Christmas. Now, my brother lived very close to Bob. Unfortunately, I don't. I said, Meryl, we're not getting Bob a bike. We're getting you and Bob a bike. You're going to ride with him. Because I knew you got that bike for Bob. It's never going to ride it. You've got to be willing. You, whoever it is, the support system, need to be willing to literally hold their hand until what? Until it becomes a habit. And I know you exercise, we exercise, we're feeling bad. We're going to exercise. It's part of our lifestyle. Until it becomes part of their lifestyle, they need that support. Hence the certification, because one of the people they will listen to is somebody in authority, personal trainer, a yoga instructor, the healthcare provider, the healthcare coordinator at a business. And those people need to know these things, and they literally have to do it. And here's the beauty of it. Studies, the Move Your Mental Health report that we've compiled, it's not a research that we've done. It's compilation of research that has been compiled, shows that one of the best way to get compliance initially is what? In groups. So here, you as a fitness trainer, you as a healthcare, as an educator, whatever, you get people as a group to do something a la walk, a la ride bikes, a la go on hikes, it's not just let's all go into the gym and see how much we can bench press. We didn't say exercise, we said movement. Let's just get people moving. Yeah. And there's something everybody likes to do. And a lot of the time, they've never even found it. They didn't realize, God, this is fun. And at the end of the day, we've never had anybody that's come to us, and we've got literally hundreds of thousands of members and clubs all over clubs in Australia. We've never had a guy come up to us and say, Vic, I got to quit. It's too much fun.
It's good.
They don't have the time. They don't have the time. They don't have the money. They're stressed out. But never, I'm enjoying myself too much. I got to quit.
That's great. And we need, if we're going to try something new that we have never done, we have to have support, a coach, a teacher, a group. And that can also, make it fun. It is part of that positive stress growth curve too, that you were talking about.
Someone to connect with, as well as we're all been pulling out of the pandemic. This whole reversing loneliness and isolation is critical for everyone's mental well-being.
Absolutely. I mean, the whole curve of mental health have shifted. We're all stress sensitive. We're all more vigilant. We still haven't recovered. And so we must have these practices. It's now not just for enhancing health. It's like survival in this kind of new era that we're in.
You can be languishing even though you're at the other end of the continuum. It's lifestyle.
Exactly. So let's talk. So as a stress scientist, what you're saying resonates so much, because we know that the most fundamental aspect of stress management is connection, is support, is feeling that there are others who understand you. It doesn't have to be a big group, it could be one person, but this idea of a coach just hits all of the bullseyes of what people need when they are suffering. And it's a strength to be able to have a supportive coach who's trained in mental health. And it's, just to think that we can all solve our mental health individually with pills and individual therapy, it's not working. And so, those are good, but they're not enough. So the mental health coach model is a paradigm shift, and it is going to change mental health worldwide, especially with your certification program. It's going to create careers that are very meaningful to people and fill a gap. Now, I want to move into stress. And of course, I have I think we all share passion for understanding the science of how positive stress to the body can improve mental health and create stress resilience. And you guys live that. I think Lynne is, I'll just say one of the best examples of people I know in this earth who has been through a lot and has used the different strategies. And I write about you in my new book, The Stress Prescription, to demonstrate how we can use these strategies to metabolize stress. It's not saying we don't need therapy, but we need bottom-up strategies. Our whole nervous system's in the body. So I'm going to, with delight, invite you both to talk about how can we use positive stress to build mental health resilience?
It's a great question, Alyssa, because so many people understand that positive stress, yes, helps to improve your body on a cellular level, but there's such a huge, as you just mentioned, connection between the mind and the body, the brain and the body. And what I think a lot of research is showing is that the same kind of restorative, renewal, recovery that happens on a cellular level to the body also happens to the brain and helps enhance. And the John W. Brick Mental Health Foundation has been really excited about the UCSF study that we helped to sponsor and with you. And it's been a great experience to see how positive stress and mental well-being promotion toward flourishing has been one of the key elements. So, in terms of largest analysis, this was the largest analysis ever of types of exercise. When we studied high intensity interval training, meditation, Wim Hof, and then a control group, right? And the effects of exercise on mental well-being, and there's peer review as well. And then soon to be published, we're very excited, is the trial comparing positive stress of high intensity interval training and Wim Hof method breathing, which is really one of the best examples of positive stress, to compare it to traditional stress reduction, and such as meditation and breathing. And we all know that meditation, and especially slow, controlled, deep breathing, helps to activate that parasympathetic system, which enhances the relaxation response. So it's great that we're going to get some publications and information out to the public so we can share the good news.
Yes, I'm excited. The public will be able to read this in the next year. It will all be public. Of course, we can share the results in general, as Lynne said, we directly compared the positive or hormetic stress interventions to the calming typical ones, like mindfulness meditation, and showed in a direct comparison that they were equally effective. They were all effective. And the beauty of that is it's not a horse race where one's better than the other. It really is, wow, different paths to well-being. The more we use, the better, right? If we can have both. And so we'll be sharing later this year the mechanisms. They work differently, but the outcome for what matters, mental health, is the same.
Yay.
And so tell us about what you guys do. What's, let's say, top 5 things, practices that you use for your own emotional well-being?
Well, I put a lot of positive stress on Lynne. So you go first.
Oh, okay. Well, first of all, I love to be in nature. And so I love to do my mindfulness walking or meditation walking on the beach, through a labyrinth, out in the woods, Shinrin Yoku or forest bathing. I love doing that. Second, I love to, of course, exercise, combining strength training and cardiovascular training. I love that combination. It just makes me feel good. And here's the thing, you don't really need to spend a huge amount of time doing it. 20 to 30 minutes will get it done. In addition, I love to do yin yoga, where I can focus on my elasticity of my joints and my muscles through restorative, put my oxygen mask on first type of activity, as well as deep breathing, breath work, and laughter is my favorite form of exercise, I think, and mindfulness.
She would call me out of the bedroom to watch commercials she thought were funny. I mean, that's how her laugh.
I always laugh a lot when I'm with you too.
It's very strong medicine.
Absolutely. I also think of you two as very spiritual people. You're, deeply generous and moved by helping other people. And how does that fit into the way you view mental health too?
Well, really quickly, I'll go through what I do and then I'll answer your question.
Yeah.
To answer your question, studies have shown that psychologically, when you walk by somebody that is asking for help, a la money or food or whatever, psychologically, it affects you that you didn't help that person when you know you could have. And you rationalize it's going to go to drugs. It's, I don't have any money, whatever. But the bottom line is, you could have made his life, made him a little happier, even if it might not have been for the right reasons. So the point is that studies have shown that when you do help people, it helps you. You're helping yourself. Happiness. 2 things that are most important in the world are love and happiness. And there are 2 things that are in very high demand right now. How many people, we're going to talk about connectivity and love, loneliness, how devastating loneliness is to mental health. Gen X, Gen Y, Gen Z states, in a big survey, 10,000 Gen Zers, 30% said they had no close friends. 30%. Here's an even worse statistic. 22% said they had no friends. No friends. There are so many people that do not feel loved. And if you do not feel love, how can you be happy? So those 2 things. So one of the things we try to be is a day maker. And I could go into all kinds of things there. But the other thing we do is we realize everything we have is a gift. We didn't do anything to deserve what we had. Most of what we got was a gift from God, and you can look at it as luck. Now, we got good LOL. ROL. You've heard of ROI, return on investment. We got a pretty good ROL, which is return on luck. So we definitely had to work. But initially, that break, we didn't do anything for. It just occurred. So why don't we help others with our blessing? Why don't we pass it on? people call pay it forward. We always said pass it. So all we're really trying to do is pass it on. So that's in response to how that helps us. And it's like, remember that positive stress? Give until it's getting a little stressful, because otherwise it's just a throwaway. And we do it with our time, like with the John W. Brick. This is all nonprofit. Now, in the old days, some of my other companies were nonprofits, even though I didn't want them to be. They are, they're okay now. Yet, so, and then
you've mastered that one.
But the 5 things that I do, like Lynne, one, we both are very, it sounds like we have all this time in the world and we spend all it doing these things. We're very appreciative of our time, and we're very prudent with our time. So I like to combine things. So for mental well-being and for fitness, physical fitness, I'll do strength and cardio, half an hour one, half an hour another. So it's an hour of training 3 to 5 times a week. Then I'll do yoga, because you got to do your stretching if you're lifting and training. I'll do yoga 3 times a week, so I get in the mental, more of the mindfulness, but also the physical strengthening, physical stretching, recovery. And then I'll do qigong twice a week, and qigong is a form of the best thing to relate it to is similar but different is Tai Chi. It's slow rhythmic movements, but it's more of a movement meditation. And then, so that's the exercise, the qigong, the yoga. I do infrared saunas, as does Lynne. We have an infrared sauna in our house here in Florida. We have our house in Maryland. We put an infrared in. And in the infrared, infrared helps you to recover, helps to rejuvenate. And it helps with mindfulness as well. And then finally, I do the Wim Hof method. I'm a big believer. I know Wim, you know Wim, we know Wim. And I do the cold showers daily. And down here in Florida, not really cold. Up in Maryland this past weekend, and in New York, it'll bite your butt. And the breathing, I do these cold showers every day, and the breathing, I try to do it 3 or 4 times a week. Now, like everybody else, we don't always do it, but here's the thing, same thing with mental well-being. One of the reasons why, and with general fitness and losing weight, et cetera, nobody does it religiously. And if they do, their priorities are a little out of whack.
Thank you for saying that, Victor. I think you made everyone listening
because really, when family calls,
guilty.
when friends call,
yeah,
when holidays call, that's what life's about. So
stressful events, we always get off track.
But we always come back to it, and that's the big thing.
It's like a form of resilience.
Correct.
So it's 2 things. One is it's remarkable how much you incorporate into your own lives the different strategies, but without being fanatics, rigidly disciplined. I do admit, I think of you, Lynne, when I'm not wanting to get on the Peloton, and I just think about how regular you are. It's the coming back to it. It's never losing it completely. So it would be great to hear, in closing, a few wishes you have for everyone listening with different bodies, different levels of mental health challenges, what you wish for them and what you wish for the foundation, which I'm so devoted to. It's been, it's been a model that has been very impactful to me, even though you'd think a mental health researcher would already know everything, and to be able to do some of this research that's truly integrative. So I want everyone to learn about the foundation. Please support it. This is a light shining on earth that we need to support this type of work. And we've got enough kind of paid for profit forces against our mental health. And so we need to, really support the values of natural rejuvenation from within in these ways that you guys have been describing. So let me turn it over to you for some final words.
All right, just really quick, I wanted to just say that to everyone listening, just start somewhere. Wherever you are today, just start by taking a few extra deep breaths, maybe stretch a little bit taller, higher, just take 5 extra steps or 10 extra steps, or do a squat position for an extra minute, it's the baby steps that will eventually build up, and that's adaptability, and that's what positive stress helps you to gain, not just for your physical body, but for your mental health and well-being. And I invite you to also go to the website, as I mentioned. It's the johnwbrickfoundation.org is our website, where you can log on for the drop-down menu for the Move Your Mental Health report and learn. It's interactive, and learn about different ways that you can engage in some type of activity. Now, if you've experienced any kind of depression and it's harder to move, find a buddy, find a coach, someone to help you, hold your hand, and focus on eventually building yourself up to the point where you can exercise 3 to 5 times per week with moderate intensity exercise. That's what's really been found to be most helpful. Additionally, if you experience any anxiety, it's time and opportunity to slow down. Again, don't feel alone. You can contact a coach, a neighbor, a friend, a family member, coworker, and maybe take some breath work classes together. Maybe do some qigong or yoga or some other mindfulness programming to help you to slow down. So that's a great place to start.
Yeah.
And what I would like to see is self-care to be given the respect and be on the same level as healthcare, and for it to be integrated. You hear all the time alternative. I got this alternative medicine, alternative. Nobody wants to be alternative. It should. Nobody should want to be. You should be integrative, that we work together in that paradigm, that model that I said, and that people realize they can make a difference. They can be part of that support system the way my brother and I and Lynne were, and my brother's wife, we're the support system for my other brother, Bob, and he's a success story. I maybe should start a foundation for him, but it does work. But you know what it is? It's the long game. And a lot of people don't want to play the long game. Bob didn't lose 60 pounds in a week. You take a pill and you can be, boom, It's the long game. And there's no finish line in life, guys. There's just no finish line in life. It's all these things. When can I stop exercising? Hopefully never. When should I stop eating healthy? Hopefully never. When can I stop helping my loved one that has this issue? Never. It's the long game. Understand how important that support system is, either for you or for others, and provide it. And then, of course, it's about connectivity, which I've just been talking about, and coping skills. And the coping skills is the education. And that's where the John W. Brick Mental Health Foundation, and there are others, the Staglin Foundation, there are other great foundations with a wealth of information, but also for you people in the fitness professional field, and even for you that are the direct caregiver. If you're the Merrill for your Bob, you should get certified so that you know what to do for your brother, for your wife, for your loved one. Why not? And there are so much more that can be done to, again, improve happiness and love of life.
Oh, so beautiful, Victor. And I'll add to that list people who have found exercise to be helpful with their own mental health. Whether you think of yourselves as recovered or just chronically coping, get that degree, get that certificate, help other people in the way that you've been helped. That's adds to the kind of purpose. So
the purpose of the certification is to what's the word? Democratize self-care. Democratize. Yes. So everybody can know what to do, because most people know how to build muscle and they want to get stronger, and most people know if I want to lose weight, I can run. But how do you really manage mental well-being? Managing mental well-being is what we're talking about.
Yes. So starting with the small steps, I'm so encouraged to be reminded of that, Lynne, that, we don't need hours a day. We need to take advantage of these small bits of time, and for that kind of burst, or starting where we're at with movement, the importance of movement, and the importance of destigmatizing mental health, and how we need to be talking about this so much more, about our personal experiences, our family experiences, our need for self-care, and leaders in every form, leaders of families, of friends, of institutions, that is a very powerful role to role model the self-care of mental health, or just, also the getting rid of the stigma by talking about coping with mental health conditions. And then your return on investment, return on investment for love. What was that called?
Return on love, ROL.
Okay, let's end with ROL. And you are such loving people. I'm so grateful to be friends and to be part of this movement with you. So giving you some return on love.
Oh, I love that. Thank you.
There you go. That's another ROL.
Beautiful.
All right. Thank you so much, everyone. Enjoy the summit.